Hello, it's Dr. Larry Komer of the Komercare Clinics, and today I want to discuss a topic that's very dear to my heart. It's our veterans. I have a lot of veterans in my practice, a lot of stories. For some background, my wife's grandfather died in 1916 in Europe in the First World War. Her father spent 6 years in Europe away from the family fighting. My father lost his hearing making bombs during the war. So veterans are very dear to our family, and Remembrance Day is important to us. I look after a lot of veterans. Why? Because they come back with PTSD or with concussions. How do they get concussions? Bombs and guns going off. One of my veterans' job was to have a rocket launcher on his shoulder firing at tanks in Afghanistan. And every time he blew that rocket, he said my brain rattled for 12 seconds. He was getting a concussion on every time he did that. One day he had 30 explosions sending the rockets toward tanks. He did 3 tours of duty for our country. And he came back with bad post-concussion syndrome and PTSD. That's what we treat. And we got him almost completely better. And what did he do? I said, what are you going to do now? And he said, I'm going to become a police officer. And I said, you've done your time. You've helped our country. That's the other tough job. There's a lot of anxiety and depression and things that you've already gone through in that job. And he said, yeah, but I help Canada overseas. I want to help them at home. And I just thought, there is a person that really cares. Those are the people I see, the veterans. I see so many of them that have seen stuff that none of us should see. And they've told me stories, and it just makes me sick of what they saw. And so it affects their brains. We can fix them. The PTSD that we see in veterans is very much like post-concussion syndrome. They often knock out their hormones. The male veterans, their testosterone, the female veterans, their estrogen levels. We can restore those levels. What do? Increase blood supply to the brain. Well, that's going to help brain function. That's going to help memory. That's going to help mood. And what else? Anti-inflammatory supplements, because there's inflammation in the brain after those injuries. Almost 90% of people with PTSD have had a previous head injury. And so they're sort of more likely to get PTSD because that brain is already inflamed and less resistant. So we treat all of that, and we've had great success with our veterans. I've had several skirmishes with Veterans Affairs who did not want to pay for patients' treatment, and I've gone to the wall for them and made sure they got the treatment they deserve because they're looking after us overseas and at home, and they're very, very important to us.